Hey, good morning. Welcome to the weekly COVID briefing for the State of Utah COVID response. Today is Thursday, January 14th. Our speakers today will include Governor Cox, Lieutenant Governor Henderson, Dr. Angela Dunn, and Dan Hemmer, the Director of the Governor's Office of Economic Development. Governor Cox.
Thank you so much, ladies and gentlemen. Welcome to another briefing on our COVID-19 fight. When I became governor, I made some commitments to you, some things that would be done a little bit differently. One of those is that we would start on time, because your time is very valuable, and we're doing the very best we can. And I appreciate our team who works so hard to make sure that we can start on time. The other thing I mentioned is that we would be focused on the fundamentals, on increasing testing, vaccine distribution. Dr. Dunn is going to give an update on testing, some strides that we've made over the past week that we're very excited about and very proud of. You've likely seen the numbers today that show that we are increasing testing, and our positivity rate is going down. The spread of the virus is going down. Again, testing, contact tracing, and of course, vaccine distribution. Last week, I stood here and told you that we were going to significantly change the way we were administering vaccines, and increasing the speed at which we were doing that. I want to thank all of our partners who stepped up and took the call to heart last week. Today, we have administered 133,202 doses. Now, that is really significant, because if you compare it to where we were 1 week ago, we were at 68,030. So in the course of 1 week, we basically doubled the amount of vaccines that we have administered, over 60,000 vaccines administered in 1 week. So as you know, we started letting teachers get the vaccine this week. Tens of thousands of teachers have already received the vaccine. We're so grateful for them and what they're doing to help us keep our schools open. Now we do recognize that there were some changes, or potential changes, some advice given by the federal government yesterday, potentially recommending starting to vaccinate those who are 65 and up. We announced last week that on Monday, those 70 years of age and up would be eligible for the vaccination. We're going to continue with those 70 years of age and older for a couple reasons that I will explain shortly, and not open that up to 65 and over yet. And the main reason for that is that we have so many people 70 and over who want the vaccine that adding 65 to the mix would not change that. There will be no availability, because we don't have enough vaccine assigned to the state of Utah right now to even cover those who are 70 years of age and over the next several weeks. The other thing that I want to point out, and why we are so focused on those 70 and above and those who are in our long-term care facilities. If you look at the deaths that have occurred here in the state of Utah, if you take those who are 70 years of age and older and those who are in our long-term care facilities, that comprises 73% of the deaths in our state. That is over 1,000 of the fatalities are in those two groups, again, 70 and over, and those in long-term care facilities. That is why we are so focused on those two groups right now. We fully intend that as soon as additional vaccines are available, that we will open up to those 65 years of age and older, and those with multiple comorbidities. We're working through that with the health departments and our local health departments right now, figuring out what the appropriate mix is moving forward, again with a limited resource, and we can't wait to be able to expand that to larger populations and other groups. I know everyone is anxious to get in line to get the vaccine. Please know that we will do everything possible as those vaccines are available to us to open it up even more broadly. I fully anticipate that by the end of February, early March, that we will have those 65 and over and those with multiple comorbidities included. So be patient. Know it's coming. The weeks are going to fly by, and the vaccines are going to get into arms as quickly as we can so that we can get you scheduled. Now, last week, as part of this change and as part of empowering our local health districts based on geography, all 13 of them, to administer these vaccines going forward, I asked Lieutenant Governor Henderson to visit all of our local health departments, which are charged with doing this. She's already been traveling the state. She has met with several of them already. She's here to report on what she has found and how we can remove barriers to make sure that nothing is slowing down the rate of vaccination. So I'm happy to invite to the podium Lieutenant Governor Henderson for an initial report. Lieutenant Governor?
Thank you, Governor. Good morning. As the governor mentioned, he asked me last week to visit all 13 local health departments. I started those visits yesterday, Tuesday. Tuesday I visited 2, yesterday I visited 3 in kind of the eastern and the southern part of our state, also clear up north. So yesterday I was in Blanding, Vernal, and Logan. And the day before I visited Southwest Health Department in Cedar City and Central in Richfield. And I've seen firsthand now vaccine distribution and administration into teachers, into healthcare workers, and also as some of the elderly people have been able to come in and get vaccinated as well. And my primary objective for my visits, as I've been talking to our local health departments, is to make sure that they understand that the state is fully behind them and that we are here to remove or to help with any barriers that might be getting in their way to actually getting these shots in arms as quickly as possible. So the 3 main objectives that I reiterate to each one of them is who is eligible for the vaccine, and that the vaccine needs to be used, 100% of the doses need to be used within 7 days per the governor's executive order last week. But I'm also pointing out that if they can do it faster, they need to do it faster, because the faster that they can get doses in arms and exhaust their supply of vaccines, the more vaccine we can get them. And then the third piece of this is a reporting component to make sure that we understand how many doses have actually been administered. Every morning by 7 a.m., those reports need to be in place. And some of the barriers that we're seeing out there that are prohibiting some of this or making it difficult are personnel issues, technology issues, and funding issues. And so we're working nonstop to try to make sure that we are eliminating those barriers for our local health departments. One of the other things that I'm asking of them, which is very important to our state plan moving forward, is to find out from them what their max capacity is, so that as we get increased numbers of vaccines in the state, as we get second doses, that we understand what our local health department capacities are to be able to administer as many doses as possible. And have them put a plan in place for reaching that capacity and how the state can help support that, what needs they might have that we can help them with. These visits have really helped me, and Director Rich Saunders has come with me on these visits. It's really helped us be able to see how different things are in every corner of the state. And that's the beautiful thing about using health districts, is they are tailored to the individual needs of their own communities, and that's exactly what we need to have happen. We've seen wonderful partnerships between our local health departments and school districts, for example, and school nurses, or hospitals, or nursing students from surrounding higher education institutions. And so as we've seen this, it's been wonderful, it's been encouraging, and we're very motivated moving forward, and our health departments are just doing incredible work. Their efforts are huge. We're so grateful for our public health partners. The last thing I'll say is, as we're working to make sure that our current populations that are eligible for vaccines get vaccinated, these are safe vaccines. There are so many people that are incredibly grateful to be getting these vaccines, and we're just grateful for the work and the support of everybody throughout the state. Thank you.
Good morning. So our rolling 7-day average of new cases is now 2,575. This is a decrease from last week when we were at 2,952. And our percent positivity has also decreased. We're now at 26%. Last week we were at 32.7%. We are certainly moving in the right direction, and it's so promising that the really high case counts we saw for a few days last week were not sustained. We need to keep slowing the spread of COVID. Our hospitals continue to be overwhelmed. So thank you for doing your part, but please continue to do it. Please continue to wear face masks, stay home when you're ill, and get tested if you're a close contact to a confirmed case or have any symptoms at all. Two of the most important things that we are doing right now to slow the spread of COVID include, of course, vaccinations, but also testing. We have flooded 33 communities with rapid testing across the state of Utah following the holidays. These are communities that had very high case counts or had very limited testing capacity. And this is so we can identify individuals early on in their disease and slow the spread of COVID. I will say that over the past few weeks, we have tested over 13,000 individuals as part of this effort, and 1,677 of them were positive for a 12.8% positivity rate. A lot of these positive individuals wouldn't have otherwise sought out testing. So this effort has definitely decreased spread, prevented outbreaks, and made our schools and communities safer. Thank you.
Hi, I'm Dan Hemmer, the Executive Director of the Utah Governor's Office of Economic Development. In addition to the public health issues, I'm here to talk about some additional support the federal government has put in place for our small businesses here in Utah. There's a new round of Paycheck Protection Program loans available. And applications opened yesterday, and they're available on a first come, first served basis. Most Utah small businesses, even if they only have one employee, can apply and qualify. And this includes businesses that received the first round of the Paycheck Protection Program. There are several participating lenders, including banks, credit unions, and fintech companies. If you have a relationship with a financial partner, go to them for assistance on how to apply. If you don't, please go to our website, coronavirus.utah.gov/business for a lot of information, up-to-date information on this program, and one-on-one assistance which is available. The state's assembled the latest information there, and you can submit a request and you will get a call back from our rapid response team to help you navigate this process. The state's team includes the Suazo Business Center to help support Utah's multicultural businesses and business owners. The SBA is also standing by to assist with this. The PPP loans of up to $2 million are available to small businesses. They're guaranteed by the SBA. Similar to last time, you have to go through a loan process. And one difference, though, is you have to demonstrate a revenue loss and can only have up to 300 employees. There are special terms for companies in the accommodation and food service business industries. And on Monday, we hosted a 30-minute overview of the PPP program. That webinar is available on GoEd's website and YouTube channel, and it can answer a lot of questions you might have and provide valuable information for businesses and nonprofits who are interested in applying for this new round of PPP funding. We want Utah businesses negatively impacted by the pandemic to apply for this assistance from the federal government and to make sure that Utah businesses are getting their fair share of this program. On the first round of PPP, we had an outsized participation by Utah businesses and hope we can do that again to help these businesses bridge through this pandemic period. Again, for the latest information and answer any questions you may have, please go to coronavirus.utah.gov/business. Thank you.
Thank you, Dan, for that information. We're constantly working on the economic side of the pandemic as well. We're grateful for your leadership and encourage our small businesses in the state to take advantage of those resources that are available. With that, we can take some questions now. Dr. Dunn is here, and anybody else, of course, Lieutenant Governor is here as well, or Dan Hemmert can take questions. And if there aren't any questions, we're certainly happy to. I would be shocked.
Here we go. Governor, hi, it's Sean Means at Salt Lake Tribune. Yesterday, on the first day, people 70 and older could make appointments for the vaccine. We saw overloaded phone lines, crashed websites, seniors unequipped to deal with the technology, and some counties having no information on their websites at all. Do you feel like you threw the county health departments in the deep end of the pool without sufficient support? And what specific resources is the state making available to help these local departments?
Sure. Thank you, Sean. Not at all. In fact, it was the local health districts that were excited about this. They asked for this, and they're still getting ready for this. Again, Monday is the day that they will start delivering those vaccines in most health districts. Some have already started in those 70 years of age and older. And what I will say is that this is actually great news. It's news to our ears. What it means is that there is so much demand, especially amongst our seniors, to get this vaccine, that it did overwhelm some of their systems. I told people last week that this is going to be bumpy, that we need people to be patient, and the good news is that that is happening. You mentioned Salt Lake County Health Department. That was one where the website and the call center went down. To their credit, their employees were working around the clock to fix those issues, and they were able to schedule over 30,000 appointments, which is all the vaccine that has so far been assigned to them through the end of February. That is one of the success stories. Although there was some failure in the rollout, by the end of the day they were able to schedule 30,000 people. Now, we recognize that there are more people, more demand than those 30,000 in that area, and that's true elsewhere. What we've said is the reason we're doing this by geography is that every health department will be doing it their own way, and it may be different. Some of them don't have the information up yet, but that information will be up today or tomorrow to start scheduling, and they will work very closely with their own populations. As far as resources that we are making available, the Department of Technology Services has reached out to all of the county health departments to volunteer their services on the websites or other technology pieces that are needed there. We are working with the National Guard to send out actual nurses and people who can deliver the vaccines for those health districts that don't have enough personnel on the ground. We're working with the Governor's Office of Management and Budget, as well as the LFA on the legislative side, to make sure that we have funding available. And I have to tell you, this is not the norm for those of us that have worked in local health districts. I was on the board of the Central Utah Health District for many years. They're not used to having unlimited resources. And so their instinct is to do what they've always done, and that is to figure it out, to use duct tape, to piece it together, to make it work. And we have them coming and saying things like, well, we would like to have a location where we can have a high throughput site, but that would mean we would have to rent a place. And what we've said is don't wait, don't ask, do it and send us the bill and we will pay for that. We will make that happen. We have funding available. So that's news to them. I would like to have the Lieutenant Governor come and talk about some of the things that she's seen and resources she made available, but specifically about how to reach those who maybe can't log on to a website or don't have the technical expertise to come to us where the vaccines are happening. Lieutenant Governor?
Thank you. One of the biggest concerns, specifically yesterday, for example, we really want our local health departments to be reporting into the state system the number of vaccines that were administered the day before. We want that reporting done by 7 a.m. In one of our local districts, I discovered that it was the nurses themselves at the end of the day who were gathering up all of that information and then sitting there inputting it into the computer. And that's one area where we said, okay, look, if you need help with data entry, if you need help with your website, if you need help getting a better reporting system or a better system for getting your people scheduled, we're going to help you with that, because the nurses can do certain things that other people can't do, and we can help provide people to do those things that really anybody could do. They just need bodies to be able to do it. And so it's things like that we are working on. Also, a lot of the people in the elderly population really want someone to talk to about the vaccine. They want information. They want to talk to a live human being and get their questions answered. And maybe some of these folks, one of the other problems we ran into is some scheduling systems require an email address. And some people in some of the older populations don't have an email address, and that was a barrier. So we are working with we've put DTS on this one as well. We've got the state, the COVID hotline, the poison control that can answer questions. So we're working with them to get these numbers on their websites so that people have a live person to call to answer the questions and to help with scheduling and to help with data entry. Those are some of the biggest things. Another bit is actually billing. We discovered that it takes 3 times as long for data entry, for administration work to bill than it does to just get someone in the door and get the $16 or $20 or however much it is paid for by the state for that actual vaccine. And so that's one area that we're working on to try to make sure that we're smoothing out these edges so that we can ramp up and get to max capacity as soon as we have the doses available.
Okay, can you quickly tell us which health district it was that had the nurses doing the input?
Well, I don't know if I want to or not, actually. So, look, I will say with this health district, they're doing a very good job, and they were actually completely caught up on their reporting. That was not the problem. There was no lag at all in their reporting. What concerned me was the fact that it was the nurses themselves that were doing it, and that's one thing that they just don't need to be doing, and we want to help with that.
Next question.
Yes, good morning. This is Rick Aaron, ABC4. We heard the Lieutenant Governor mention technology as one barrier to distribution. We've heard problems in other states with the tracking process and the software used to track the vaccines and recipients. Could you just comment on what Utah is doing and if that has been a hurdle to overcome?
Yeah, it has been a hurdle to overcome. And so what we're doing is we've been auditing the system over the past week, really over the past 2 weeks, physically auditing the system. So going out to all of the locations, of course, most of those locations were hospitals early on, actually physically counting the doses that they have in storage, looking at the paperwork, making sure that all of that matches up with what has gone through the federal reporting system, and working to overcome any discrepancies. So we're feeling pretty good about where we are right now. We did find some discrepancies, and we're able to correct those over the past couple weeks. And we're just grateful for all of the partners who are figuring this out on the fly. Some of the problem was the technology on the federal side. Some of the problem was just again data entry, which is a big piece that the Lieutenant Governor talked about, and making sure that we have resources for data entry. People get so involved working on getting vaccines in arms, which is what we want, that we've got to make sure that that paperwork piece is done. And there's a reason this is so important, not just so we can track who has gotten the vaccine, which matters because there's a second dose, and we have to let them know and schedule those second doses and remind them to come back and get the second dose. But it's important because that's how, as we move forward, that's how we're going to get more doses. When it doesn't matter how many we've actually done, it matters how many we've reported. That's how the federal ordering system will work to replace those doses. So if we've administered 20,000 more vaccines than are being reported, those vaccines are not going to be replaced, and we'll lose out in the race to get this done. So we've got the best people working on this. We feel much better today than we did 2 weeks ago about where we are on the reporting side. Anything else, Dr. Dunn, on that? Okay.
Hi, Governor Cox. This is Sophia Eppolito with the Associated Press. I was curious if I could ask about this expanded testing. It's great to see our percent positivity rate start to go down, but we had heard the prior administration talking about wanting to expand testing to this degree as far back as August. Now that we're 10 months into this pandemic, can you explain why it took so long to get this up and running?
Yeah, there are a couple reasons it took so long, and the biggest, and I've said this before, that when the story of the pandemic is written, the best part of the story will be vaccines and the rate at which we were able to develop and get vaccines out. The worst part of this, besides the politicization of things, but the worst part will be that the federal government didn't go all in on testing. And so the states have been competing for tests. The development of rapid testing was much slower than people expected. We've had to beg, and we haven't stolen, but we've considered it, and borrowed testing from the rapid testing, the Abbott Binax Now test. We had to, we actually had representation from the federal government who was here. Governor Herbert asked them, they promised us a certain amount, then they didn't deliver that amount. We had to call everyone we knew in Washington, D.C. to get those amounts. It has been a huge struggle for all of us, every state, to get the testing that we needed to get where we want to be. What has changed is over the past several weeks, new antigen testing, new testing suppliers have come online, and their production has ramped up. So we purchased well over 1 million tests. In fact, we purchased enough tests, we believe, that should get us through June. And that has allowed us to significantly increase the amount of rapid testing. Also, they're easier to deliver. The problem with PCR testing, it's a little bit like vaccines, is you have to have professionals that can deliver or that can administer these tests. Now we have rapid tests that can be administered by school administrators, not hospital administrators, not nurses, but regular people. We can do those types of things. I've been trained to be able to administer some of the rapid tests. We can do those types of things. It's much easier now because the technology, the type of testing has changed, and the amount of tests we have available has changed. Would you like to add anything, Dr. Dunn? Just talk about how we set these up, maybe, and why we're expanding it.
I mean, exactly what Governor Cox said. We have more testing capacity because production sped up and rapid testing sped up. And so what we've been able to do is essentially open testing up to anybody. So if you go to testutah.com, you can sign up and get tested regardless of your symptoms. And then the rapid testing across the state has really allowed us to understand who's positive in situations where we need to pull them out quickly, right? So our school settings are safer, and we prevented community outbreaks because of this. So it is really exciting that we have testing now. Yes, we should have had it earlier, and that is something that will definitely come out in history. But But that is the reason for more testing now, and we can see it's working. Our percent positivity is decreasing as well as our cases. So please get tested if you have symptoms especially, or if you are a close contact with somebody.
Okay, last question.
Hi there, Jenna Rowe from Channel 2. I just wanted to ask you about planned protests for over the weekend. We know that the Utah National Guard is on standby over the weekend, and I'm just wondering what it would take to deploy the National Guard, and if this should happen, kind of what their role would be over the weekend.
Yeah, thank you. So we have been working very closely with our Department of Public Safety Commissioner Jess Anderson. We've been working with the National Guard, with our TAG, our Adjutant General, General Turley, and with legislative leadership and everyone involved in the Capitol complex to make sure that we are prepared for whatever might come our way. Of course, our message is that we would ask the citizens of the state of Utah and anyone who may be thinking of coming to the Capitol, we respect and honor your First Amendment rights to gather, but we want to make it very clear that the Constitution only protects your rights to gather peaceably, and that there will be zero tolerance for any violence whatsoever, any property destruction. We have together with the Highway Patrol, who, as you all know, are tasked with security here at the Capitol complex. We are bringing in all of our reserves that we can with the Highway Patrol. They will be ready this weekend. And the National Guard will be on standby. You asked what it would take to actually make them active. It's not going to take much at all. As soon as we see those gatherings start to occur, they will be here to make sure that our Capitol is not vulnerable in any way. Thank you. And I believe that concludes our briefing for today. Again, we appreciate everyone who has participated. We would encourage you to visit coronavirus.utah.gov for all of the latest information, both health-related and economic-related, and vaccine-related. We want to thank our local health districts for the yeoman's work that has happened this week as they prepare for a surge of 70-year-olds. And again, we're so excited that over the next couple weeks that we can, again, 73% of our population that is the most vulnerable to this disease will be protected, and that's great news for everyone. So thanks. Have a safe weekend, and we look forward to seeing you again next week.